Spectacle on Television Nigeria. I am your host, Daniel Atai. The Nigerian healthcare system and why it must work now with the planned revitalization of 10,000 primary healthcare facilities across the world. Welcome to Spectacle. I am your host, Daniel Atai. And with me in the studio to analyze these things is Comrade Oluchi. Comrade Oluchi, you are welcome.
Thank you very much.
Please conclude your surname for me. I actually missed it up in the studio.
Okay, the full name is Oluchi Brenda.
Okay, Brenda is a Vice President of the Student Union Government, University of Abuja. And she's here with me to look into, as it concerns the tertiary institution, the NHIS facility in their campus. Subsequently, probably like tomorrow or next, we'll be having a medical doctor on this very topic to throw more light from the governmental aspect of the health sector. Now, since independence in 1960, Nigeria has had a very bad primary healthcare services with several healthcare reforms that did little or nothing to addressing the public healthcare and the challenges confronting it, either due to limited scope of legal coverage for social protection that could be blamed on governmental or political willingness amidst corruption, lack of continuity in health policy, limited institutional capacity, and an unstable economy. Otherwise, which factor could be responsible for the poor development of health services in Nigeria? Stay tuned. After this timeout, I'll be with you.
This is Television Nigerian, a broadcast network committed to serving you the very best in online and offline television programming. Situated in the serene environment of Guzape, Abuja FCT, TVN, as it is fondly called, caters to a wide variety of audience via carefully orchestrated mind-blowing programs in the areas of fashion, business, politics, entertainment, religion, movies, food and health, culture and lifestyle, events around the globe, sports and foreign news. Whatever your inclination, we've got you completely covered with programs like Issues of the Moment, The Patriot, Daybreak Nigeria, Matter Africa, TVN Business Time, Healthy Living, From the Cradle, Stay Inspired, Entertainment Gist, Movie Hour, Hits Paradise, among others. All designed to keep you thoroughly informed, entertained, at the edge of your seats and yearning for more. A tour around our domain will reveal a highly dedicated staff force and a state-of-the-art facility and equipment for high-definition quality broadcast, making our station your #1 choice in advertising your business and propagating your ideas. We are currently on NightComSat doing our test transmission for takeoff in the nearest future. Television Nigerian is located in Nigeria at Television Nigerian House, Guzape Hilltop Mansion, beside Guzape White House, Guzape Abuja FCT, and in the United Kingdom at 45 Ancient House, 48 Aerodrome Road, Beaufort Park, Colindale, London. For inquiries, Television Nigerian, broadcast beyond boundaries.
Welcome back. Now, successive administration came and gone from both the military era and democratic dispensations. Yet, the health sector remained a disturbing quagmire that even the elite that prides as leaders and policy makers of this nation had to jettison their own healthcare facilities and system to seek medical help in Europe and America, even from Asia and other African countries like South Africa. Households and individuals in Nigeria bear the burden of a dysfunctional and inequitable health system, delaying or not seeking healthcare and having to pay out of pocket for healthcare services that are not affordable. Besides, over 90% of the Nigerian population being without health insurance coverage. Now, in the light of this, the Minister of Health, Mr. Osagi Emmanuel Hanire, came out on Friday precisely and said the government is planning a 10,000 revitalization of the primary health care across the wards in Nigeria. In Nigeria, we have 774 local government, and we have 8,812 wards across the nation. It means 10,000 is above 8,000. Now that across the world, there will be one functional, well-equipped primary health care in all the world. Do you think this plan is feasible, judging from the perspective of what have been happening in time past?
Well, I think it's feasible.
All right.
That is, if corruption doesn't have a play in the whole process of revitalization. Okay. It's high time they even started the revitalization, because it's the issue of health care services. It's sacrosanct.
All right.
Yeah, in our everyday life. Now, the average Nigerian should be able to have access to health services without too much funds, because I know the average Nigerian don't have the large amount of funds to go access the high quality healthcare services. But the primary healthcare services provides this avenue in which they can access healthcare services.
All right. The primary healthcare center in every ward, do you think right now the NHIS, which is the National Health Insurance Scheme, is one of the bodies, whose onus is to ensure intermediary between securing insurance policies and insurance bringing down the cost of healthcare for both students in the tertiary institution, disabled ones, child and mother, wherever in the health sector. Do you think in your institution, do you have this functional facility there at the University of Abuja?
Yeah, University of Abuja has the NHIS scheme working, and we've been encouraging students to just register, just apply as a student in the clinic, and then you just have free medical access, like free drugs, free medical examinations, and so on. But in a situation in which you cannot just the school clinic, your case is bigger than the school clinic, then you'll be
sideline.
No, you'll be referred. Sorry,
Okay,
you'll be referred to the specialist, where you would have full medical attention and limited. You don't have to pay huge amount of money because you are a member of NHIS.
Okay, what are the processes to get registered in NHIS in your school?
The only process to get registered with NHIS in my school is just to go into the clinic with your whole means of identification and some medical examination, including your X-ray, and then you just collect your clinic card. That is all. It's not tedious. It's very simple.
It's very simple.
Very simple.
Do they do much about health apart from this normal test, application of drugs, and so on? Do they do something? Do they do much analysis on human body in terms of maybe diseases and so on?
In the school clinic?
Yeah, in the school clinic.
No, they don't.
Okay, it's just to little affordable like drugs and so on.
Yeah.
That's what they distribute.
Yeah.
Anyway, we do know that services like the National Health Insurance Scheme, National Immunization Coverage Scheme, Midwife Services Scheme, Nigerian Pay for Performance Scheme exist as health reforms since 1999, or precisely since 2005. One actually wonders why, despite these services and reforms in the healthcare delivery, especially the act of legislation that established the NHIS in 1999, is yet to effectively and efficiently address health issues such as 1. Access to financial risk protection, access to quality healthcare services. There is a rising cost of healthcare services and, of course, no efficiency in healthcare delivery for the vulnerable, such as children, pregnant women, and the disabled, via the following policies. 1. The provision of healthcare services for children under 5 years. Healthcare services also for prison inmates, disabled persons, retirees, and the elderly. Of course, we know that we have public primary pupils social health insurance program. We also have community-based social health insurance program and tertiary institution social health insurance program, AMIS voluntary contributors social health insurance program, also mobile health and formal sector social health insurance program, which are supposed to be the function of the NHIS. Now, that which concerns you most, students on campuses, if they have wounds like accident, something to do with operation, does the NHIS there take care of such aspect of ill health?
Yeah, it does, because I'm just going to give an example. Like, we had a case of burns. Like, one of our students, she was using her gas and then it exploded on her. So it was a very serious issue in which a lot of money is required. Okay, but because she's under NHIS in the school,
okay,
and in as much as the school doesn't basically treat those kind of high bonds and stuff like that, we have collaboration with the specialists, University of Abuja Teaching Hospital. So she was able to receive fair treatment with limited fund because of her involvement with NHIS as a student.
Which means affordable healthcare.
Affordable healthcare.
Okay, not actually free.
No, it's not basically free, but it's affordable.
The student have any card to attest that they are NHIS certified?
No specific card per se, but the only card that attests that you are under the scheme is the school clinic card.
Okay.
Yeah, it's not like NHIS brought cards to the school to distribute and stuff like that. No, it's just when you apply in the school clinic, then you get the clinic card, and that is just your means of identification that you're under NHIS, because you cannot get the card and you cannot be applied if you're not.
Okay, that is in Abuja here. Do you know how many students or how much of you have this card, or as a vice president of your student union government in University of Abuja here?
Well, I would say that not a large population of students have it, but we encourage students to get their card, go apply in the school clinic, because if, like the case of the issue of the girl with the gas explosion, if such a thing happens to you and you are not registered under the school clinic and under NHIS, which is under the school, then you would have a high amount of payments to make if you're under that kind of situation. We're not praying for it to happen to anybody, but in case. So that is why we are just encouraging people apply, register, and then have this thing on ground.
So under this administration of President Buhari, all those things you are explaining is happening at the University of Abuja there.
Yeah.
And you could attest to it that the government is working in the city here.
They are, but they should still work more harder. Yeah.
Okay, where do you want them to work more harder?
Like in provision of drugs.
Okay.
Yeah. The whole drug issue, especially malaria drugs.
Okay.
Malaria is common. It's a common ailment everywhere. So once malaria drug is not limited, I think it's a plus and a kudos to the government.
All right. Now, we have been having an issue that oftentimes, especially leaders, are actually moving out of the country to Europe and America to seek medical help, and it is a national shame per se. The other time I heard the minister giving statistics of child and maternal mortalities of about 64 per 1,000 children that dies during birth from non-accessible or non-quality healthcare services in the country, while about 576 per 10,000 women dies from childbirth due to same factor, when the services are supposed to be free under NHIS. Also, the minister couldn't tell Nigerians the number of our political leaders that could die of poor healthcare services if they are not flown to abroad, to Europe and America or Asia for quality healthcare need. It is sardonic and worrisome that since the launch of the NHIS in 2005, after its legislation in 1999, it is yet to cover 15% of Nigeria's population, a terrible phenomenon that should only be attributed to alienated nation that has no future and essence of existence. Perhaps this is the reason this administration wants to take a holistic approach in tackling the issue once and for all. We could only pray that it sees the light of the day without the usual corruption, politicization, amidst nepotistic and affiliative bureaucracy that bedeviled this sector for over 5 decades. May President Buhari live long, according to Oluchi, so that the 10,000 health facilities, primary health care facilities, be delivered to Nigerians.
Yeah. Nigeria
have, at the moment, 8,812 wards with about 119,700 something polling units. And it wonders, a little wonder that when we have a political campaign period, people seems to, the INEC, for instance, can get to the least village in Nigeria. You will see their machines and everything, their card readers and whatever going to those places. But in terms of health, in the rural area compared to the city, do you have anything to say about that?
No, I think the majority of people that need this primary health care is people living in the rural area, especially the IDPs, the internally displaced persons. They suffer a lot from the popular diseases,
especially
ailments,
even malaria.
Even malaria, typhoid, fever, cough, cholera, and all those things. So I believe that when all these primary health care, according to what the Mr. President said, when all this primary health care is looked into, is revitalized, it will go a long way into saving lives of these innocent people living in the rural area, and also helping them out, because not all of them can actually access the high funding medical care and bills and things like that. Not all of them can actually access or fund themselves into traveling out of the countries. So it out of the country rather. So it's just the least that the government can do for them. Provide primary health care to all these areas.
What would you say about traveling out for medical healthcare need after 59 years of our independence?
Well,
you are laughing.
It's a serious issue. I would say it's a serious issue. But if we keep funding our health services in Nigeria here, keep encouraging the medical doctors we have, it's gonna go a long way. Now we have intelligent people in Nigeria. We have medical doctors that are well intelligent, very intelligent, but because of lack of encouragement from the government.
What kind of encouragement?
Providing necessary facilities like laboratories for experiments, encouraging them financially and things like that, like what other countries do. It's demeaning for our own country. So I believe that once all these encouragements are put in place for all these specialized doctors. Now we have cancer center in Nigeria here along Airport Road, but I don't think it's being used. People with cancer still fly out of the country, go to India, go to different places for treatment. But if we invest in our country, if we invest in our health sector, it's a plus to us. It's a plus to us. Having other people from other countries come into Nigeria for health services, it's a plus to us. At least we've gotten to that stage where we don't have to keep traveling out of the country for headaches, for malaria, for all cancer, those things, for cancers too. So we've gotten to the stage where we have to have full access to all those equipment in Nigeria, and even have other people from other countries come into Nigeria for treatment.
And as well, what would you want to say about our medical doctors, Nigerian trained medical doctors in the United States of America and in the United Kingdom, working there as best doctors, surgeons, and so on? They are there. Would you advise them to bring their expertise home?
That is exactly what I'm saying. Sorry for cutting you. That's exactly what I'm saying. If you encourage the medical doctors we have, if you encourage the professionals we have here in Nigeria, they will have no reason to want to go out of the country to go and improve themselves, to go and work and things like that. If they have leverage in Nigeria, if you tell them come work in Nigeria, set up a standard laboratory, provide standard equipment for scans, tests, and things like that, I don't see any reason why they would want to, and give them huge pay. I don't think there's any reason why they would want to leave the country to go work somewhere else. So the government should just try to encourage her citizens. That is basically it.
All right, the government just have to encourage her citizens. That is just it. Coming from Oluchi, we'll go in a short break, and after that, we'll be wrapping up the program. Stay tuned.
The issue here we have to begin to look at is that at the time of independence, I don't know if there was a trajectory to where we are going to.
How could it be that credible, free and fair under manual conduct of election?
That is where our problem lies, and that is why people are now seeing that, advising that we should move, that the world has gone into digital. We should move from the manual to the digital.
We cannot keep doing same thing and expecting a different result.
The only way you create jobs from your ministry is that you have to encourage local content.
If you look at the profile of Sally Mama,
there is a caveat in this leave given to him. He should seek medical help if he's fine.
Welcome to Spectacle on Television Nigeria. Welcome back. We are still talking about the 10,000 proposed primary health care facilities to be, put in place in the 8,812 wards across Nigeria by the Minister of Health under the regime and administration of President Muhammadu Buhari. So soon to take off. Do you think the sensitization from these various health policies and health representatives are okay for Nigerians, especially from your background as a student of the university?
No, I think this sensitization is low.
Okay.
Majority of Nigerians don't know about this insurance scheme, that you can actually pay less or nothing at all to have access to your medical medicals.
Especially like pregnant women at the rural areas.
Pregnant women, mothers, children, infants. Now, when they have full, I think what the NHIS needs to do is go to all these rural areas, resensitize them.
While carrying out immunization and other schemes.
Yes. Tell them about this NHIS scheme, why there is a need for the rural people living in the rural area to have access to this scheme, for them to register under the scheme.
Would you want to say anything about corruption? This program was legislated upon in 1999 and then launched in 2005, this particular scheme of NHIS and the various reform of health policies. And this is 2019. If you look at the years interval between them, it shows that a lot of budget must have gone into the healthcare. Do you think that corruption is a factor and President Muhammadu Buhari will do a lot in the health sector to watch after him? We may not have to go abroad for medical help. Do you see any corruption fighting this particular proposed 10,000 primary healthcare facilities to be put in place?
Yeah, well, corruption is a very huge factor in preventing the revitalization of the 10,000 primary health care from coming into play. Now, why I said that, because people like siphoning.
Okay.
You cannot take that from an average Nigerian. But in a situation, in a situation in which you siphon what needs to go to an average Nigerian for health, I think it's very wrong.
Okay.
It's wrong. Now, when you give these people what they need, what is due to them, the whole blessings that will come upon you, you'll be surprised.
Okay,
honestly.
Okay, good.
Because when you siphon what is not meant to be, what is not yours, you will face serious issues in which you would not even be able to comprehend.
And how will they know, or how will the government know that this fund were siphoned? They have to have an evaluation team, isn't it?
Exactly.
Okay, like you were talking about sensitization, that it was poor in your school, in your campus. How do you think the sensitization should be carried out?
Well, if you're talking about my school, the way we've been able to say people should go register for this NHIS in the school clinic is that before you see your results, your academic results, you have to present your medical card. You have to present your clinic card to your head of department or your exam officer for you to be able to have access to your results. So with that, a high number of people would want to register because they want to see their results.
Okay.
So it's part of the sensitization that we're talking about. Okay. So that's the avenue for...
I learned you're a theater art student.
Yeah.
Do you have TV station and radio station on the campus there?
Yeah, we have radio station.
And you can use that avenue too?
Station. Yeah. We could also use the avenue, but how many students listen to radio nowadays when you have access to your internet and
they are watching you right now.
Yeah, I know.
They are watching you through your watch party and they are listening to you. So when you leave here, you can do more come over, sensitize them through TVN, and then ensure that they get their health policies, because health is wealth.
Exactly.
All right, that is where we will stop today on Spectacle program on television Nigerian, your socio-political and economic program on TV, and we hope to see you again tomorrow. Like I promised, a medical doctor will be here to analyze more on the proposed 10,000 primary healthcare facilities across the world in Nigeria, and we hope that this sees the light of the day. Thanks for watching, and I've been your host, Daniel Atai. Welcome to Spectacle on Television Nigeria. I am your host, Daniel Atai.